Welcome, everyone. On behalf of the Century Foundation, I'm Mark Zuckerman, the president of TCF. For those of you not familiar with who we are, we're a progressive, independent think tank that drives policy change to make people's lives better. We pursue economic, racial, and gender equity in education, healthcare, and work. If you think about it, this event couldn't have come at a better time. Momentum in Congress for maternal health and health equity has never been greater. President Biden's Build Back legislation includes historic investments in Black maternal health, including many of the bills proposed in the Omnibus. Let's be clear, we couldn't have gotten this far without the tireless efforts of members of Congress, led by the Black Maternal Health Caucus, and outside champions like some of you on the panel today, some of you in the audience, and of course, Dr. Jamila Taylor, who leads TCF's healthcare work and who will be moderating today's event. We also couldn't have gotten this far without the leadership of the Biden administration, including Chiquita Brooks-LaSure, who leads the Centers for Medicaid and Medicare Services. I know the administrator from my time working alongside her in Congress, so I know firsthand what a powerful champion she is for expanding Americans' rights to affordable, accessible healthcare. Also, I want to give a special thank you to the Irving Harris Foundation, who's been a tremendous partner in this work and is a sponsor of today's event. Chiquita, in addition to being administrator and working on Capitol Hill, was the Deputy Director for Policy at the Center for Medicaid Services at HHS, and earlier as Director of Insurance Policy Reform. It's such an honor to have the administrator here, and I just want to thank you so much for coming to today's event, and I'm going to turn it over to you for some opening remarks.
Thank you so much, Mark, for that kind introduction. I remember our time on the Hill so fondly as we had the opportunity to work and advance the Affordable Care Act. And I so thank you for all the work that you are doing to advance and improve and enhance maternal health. I particularly want to thank the Century Foundation for focusing the spotlight on maternal health equity. This is an issue that I am particularly passionate about and thrilled to be with you all today. The US, unfortunately, has the worst maternal mortality rate among industrialized countries. Black women are disproportionately impacted, dying of pregnancy-related causes at approximately 3 times the rate of their white counterparts. And according to data released in 2017, over a 5-year period, Black college-educated mothers who gave birth in New York City hospitals were more likely to suffer severe complications of pregnancy or childbirth than white women who never graduated from high school. We must level this health and healthcare playing field. And I know that's what we all hope to advance at this conference. The first of its kind, an act in 1921, provided federal funds to states to establish programs to educate people about prenatal health and infant welfare in order to curb the very high infant mortality rate in the US, most especially in rural areas. It led to the establishment of nearly 3,000 prenatal care clinics, 180,000 infant care seminars, over 3 million home visits by traveling nurses, and a national distribution of educational literature. Overall, it worked to increase access to services and address geographic inequities in health and healthcare. A landmark piece of legislation, although it was not renewed during the Great Depression in 1929, I believe it provides 3 important lessons for us today as we work to promote maternal health equity. The first lesson is the importance of access. For those behind the 1921 Act, it was a question of access to services to advance maternal and infant health. For us today, it's a question of access to both healthcare services and healthcare coverage. The health of our nation really does begin with the health of our mothers and children. That's why we're committed to reducing the rate of maternal morbidity and mortality by addressing the continuity of care needs for postpartum women. We know that Medicaid is a critical source of health insurance coverage for maternity care. In 2019, the program covered approximately 42% of all births nationwide and 65% of African American births. But Medicaid postpartum benefits only extend for 60 days. As a mother of myself, I remember that time right after you give birth, how challenging it can be to juggle new responsibilities or additional responsibilities. And I cannot imagine trying to simultaneously juggle a new child and find healthcare coverage to make sure that both my child and I were receiving the care needed. To further examine this issue, our teams from CMS, both in our Center for Medicaid and CHIP services and our Office of Minority Health, worked collaboratively over the last couple of months to pilot the equity access process. We focused on quality of care and disparities in the postpartum period among Medicaid and CHIP beneficiaries. In particular, the team examined postpartum visits and follow-up services for conditions associated with maternal morbidity and mortality, such as hypertension, diabetes, and postpartum depression. The findings from this internal assessment will be used to develop CMS guidance and technical assistance to states to support their efforts to improve quality of care and outcomes for postpartum women. And that's why I'm so glad that President Biden's American Rescue Plan now provides states with new options to increase access by extending Medicaid postpartum coverage from 60 days to 12 months. In April, we approved a demonstration for Illinois, which allowed the state to become the first state in the nation to extend benefits to 12 months, ensuring that every mother in the Prairie State can receive quality health care after childbirth, regardless of income level. Since we've approved demonstrations in Georgia and Missouri, 10 additional states have requested demos. We hope that other states will soon extend the benefit coverage, strengthening continuity of care, and reducing the rate of maternal mortality and morbidity, especially among communities of color. Of course, in order for this policy to have a measurable and meaningful impact on equity, it's not enough to simply for states to adopt this option. We need to expand access to the full range of high quality services that our beneficiaries need, particularly those groups that disproportionately experience adverse postpartum outcomes. As we work to expand healthcare, we must work also to expand healthcare coverage. That's another challenge of access, which is why Medicaid expansion is also a top priority. In July, we released our latest enrollment snapshot reports for the Medicaid program, showing that over 81 million Americans, a record high, now have health coverage through Medicaid and CHIP. But our work is not done. 4 million more Americans in several states, 13, more than half of whom are people of color, stand to gain access to quality healthcare coverage in the remaining non-expansion states. I had the pleasure of being in Oklahoma as they expanded coverage. The eagerness and enthusiasm was demonstrated where 50,000 residents applied even before it began on July 1st. And as of now, over 120,000 Oklahomans have been determined eligible for the newly expanded adult group. We encourage states to take advantage of the significant subsidies in the American Rescue Plan, and we are striving as an agency to ensure access to coverage by reducing barriers to enrollment, removing these barriers to access, and continuing to work with states to enroll all eligible people in Medicaid. And this last week, we've also been able to celebrate a significant high in ACA marketplace coverage. Over 2.5 million people were able to enroll in coverage during this year's special enrollment period, which was instituted by the president. What we've really seen through the special enrollment period was what a difference education and outreach make towards people knowing what their options are, and that the increased subsidies have made such a difference in people's take-up of insurance. We must continue to ensure equity across all communities and work to level the playing field. And so we focus there on making sure that we are level the playing field between rural and urban areas, regardless of whether people are, regardless of race, ethnicity, sexual orientation, or geography. This is a real focus of CMS as we try to make sure that all of our programs are being looked at through a health equity lens. And that's something that we're seeing really change how the agency is focused as we ask, how are we promoting health equity as our first question and not our last one? And finally, I would say that we are focused on making sure that the people we serve remain central to our work. So regardless of whatever M we are talking about, whether it's the Medicare program, Medicaid and CHIP, or marketplace coverage, we are incredibly focused on making sure that we are designing the programs in a way and operating the programs in a way that affect the enrollees. And particularly today, as we talk about maternal health, making sure that our programs are working to ensure maternal health equity. So the last thing I would say is just how much we continue to think that working with all of the stakeholders to address these issues is so critical. And we so appreciate your work on this critical issue and want to work with you and look forward to learning from you and listening to you. So with that, I hope that the rest of your conference goes very well. And I thank you for having me participate today.
Thank you, Mark and Administrator Brooks-LaShore, for your remarks. Welcome to our participants. I'm Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation. The United States ranks 10th out of 10 similarly wealthy countries in maternal deaths. Black women are hardest hit, and vast racial disparities exist. Black women are about 3 times more likely to die of pregnancy-related causes when compared to white women. The majority of maternal deaths are entirely preventable. Today's conversation is incredibly timely. There have been historic investments in maternal health by the Biden-Harris administration, reintroduction of the landmark legislation, the Black Maternal Health Omnibus, implementation of a temporary state option, as mentioned by Administrator LaShore, as part of the American Rescue Plan Act, and just last week, the Black Maternal Health Omnibus and mandatory postpartum Medicaid coverage were included in the Build Back Better Act. We'll delve deeper into these advancements as part of today's panel discussion and talk through what needs to happen next to further advance maternal health equity. But first, I'm going to start off by introducing our rockstar panelists. We have Jack DiMatteo, who is Legislative Assistant for Congresswoman Lauren Underwood. He covers health policy for the Congresswoman, as well as the Black Maternal Health Caucus. We also have Kalisha Figures, who currently serves as Special Assistant to the President for Gender Policy on the White House Gender Policy Council. She works on a range of policy issues, including education, justice reform, and maternal health. And last, but certainly not least, we have Aza Nadari. Aza brings more than 18 years of experience in community organizing, reproductive justice, and program development. She is a mother, licensed certified professional midwife, family counselor, and co-founding CEO of Mama Tota Village. Thank you all for being here. I encourage our participants to read more about their impressive bios on TCF's website. Aza, I'd like to start with you with today's first question. Administrator Brooks-LaShore highlighted renewed focus on Black maternal health, and I'm sure many of us are well-versed on why this prioritization is necessary. Before we get deeper into the policy progress, could you speak to your experience working with Mama Tota Village and how your community level work has impacted how you view the policy space?
Thank you, Dr. Taylor, for that first question, and welcome everyone to our conversation. So Mama Toto is this beautifully unique and organic space. At 22, during my last year of college, I became a mother, and Mama Toto was really conceived as a thought based on what I desired and needed for my own self, which was a village, a space of collective care for Black women and birthing people to nurture and support one another, a space of safety that validated our intersectional experiences, and a space that really reflected our beauty, our strength, and our resilience. And so when I met my co-founder, Cassetta Pringle, we really had the shared vision for what Mama Toto looks like today. The intentionality in our commitment of care is really reflected in our staff, which reflects heavily the community that we serve at all levels of the organization. And so Mama Toto's mission since the beginning has really been anchored in creating pathways of economic advancement and leadership, and in helping Black people forge pathways to self-determination, leading to both personal and community transformation. So many times in our work, we hear families come back and say, being here and getting services here and support here has changed my life. It feels different from other services that they've received because they were cared for, they were seen. And so over the past 9 years of doing this work, and really thinking about how we engage in the policy space and our role in that engagement has led us now to really hire a senior policy and advocacy manager who's transformative and phenomenal, who's really helping us to facilitate this justice-oriented, community-centered solution that's focused on enriching the quality of life for marginalized and people who've been made to be invisible. The policy space in so many ways for us, and in my experience, has been siloed. And what happens at that level oftentimes gets lost in the community, especially when we think about people being involved in the policy processes whose lived experiences in life are being impacted by decisions that are being made without their knowledge or sometimes participation. So our experience as a part of the Black Maternal Health Caucus advocacy group has really shifted that power in a way that has been community-led and driven. And the communication around that Omnibus legislation really created a bridge, allowing for folks at a local level to have awareness of how there was a direct impact of policy in this package of legislation on their lives.
Great, thank you so much, Aza. And I love the fact that you lifted up Mama Toto's role in terms of, how your organization has helped to actually advance the Omnibus and have a hand in actually developing the legislation. And we're going to get more into that a little bit later in the program. I want to shift things to Kalisha and Jack. There have been a number of advancements this year so far in Black maternal health with both Congress and the White House. From your respective positions, which of these do you think will have the greatest impact? Kalisha, why don't we start with you?
Hi, and welcome, and thank you for having me. My answer is going to be a little bit diplomatic, and I come from the place of, being special assistant to the president for gender policy and getting to be on a team of folks from across the Gender Policy Council, Domestic Policy Council, and Office of the Vice President who are leading our internal process around maternal health. And I also come to this space as a Black mother with a 2-year-old who's napping downstairs, and actually a Black mother who is 39 weeks pregnant. So literally right at the cusp of giving birth again. And both of those experiences come to how I weigh in and think about policy and what's important. And I think the real answer in wearing both of those hats is that we need to press down on multiple levers. The experiences that Black women and birthing people have in hospitals or just birthing in this country are impacted by a number of things. They're impacted by systemic racism that exists within systems. They're impacted by what the perinatal workforce looks like and doesn't look like. They're impacted by access to culturally responsive, trauma-informed services and supports. They're impacted by quality care and access and coverage and many of these pieces, right? And so I think what I really appreciate about the approach of the Biden-Harris administration, and that comes from leadership from across the building who care deeply about this issue, is that we know that there needs to be a item menu to really addressing and tackling this issue. And we're thinking about it in a bold way, right? What does it look like for the United States to be the most dignifying place, right, to give birth for any person? Chiquita mentioned the piece that really stuck, and I think Black women feel it all too well. It is not about income level or college degree or any other factor, right? There are risks. It doesn't matter that I'm helping to lead policy processes around maternal health and federal government when I walk into my weekly checkups, when I will eventually, hopefully soon, walk into a hospital to give birth. None of that matters, right? I am coming in as a Black woman and in that identity. And so what does it look like for that to be a dignifying experience for just all people who are birthing in this country? And so I think what we appreciate, in the leadership on the Hill is really looking at packages that address all of these different items, that put many of these items on the table, and that, appreciate the fact that we can't leave some of these pieces behind.
Great, thank you, Kalisha. Jack, do you have a response to this one?
Sure, thank you so much, Dr. Taylor, and thanks to the Century Foundation for having me. And such an honor to be with Kalisha and my good friend Aza on this panel. And I want to start by just extending Congresswoman Underwood's greetings. I know she is so grateful for both the Century Foundation hosting this, and I was looking at the participant list, so many people who the Black Maternal Health Caucus has worked so closely with who are participating in this. As Kalisha mentioned, the administration has been really active already. Just 8 or 9 months in to President Biden and Vice President Harris being in there. But one particular piece that Administrator Brooks LaSure mentioned that is really critical and particularly applicable in Congresswoman Underwood's home state of Illinois has been that postpartum coverage expansion, really taking a historic step through the American Rescue Plan to create a pathway for states to extend coverage from 60 days to 1 year. And Illinois, of course, becoming the first state now to provide that coverage. Dr. Taylor has actually contributed a lot of research in this space, showing what the implications of that are, ensuring that people have access to doula care, maternal mental health care, contraceptive care, all this type of support and health care that families depend on, those needs don't end 60 days after the end of a pregnancy. And so, the American Rescue Plan was a really significant step, but as Congresswoman Underwood often says, we can't stop until permanent year-long postpartum coverage is a reality for every mother in every state. And we took another historic step in that direction, as Dr. Taylor alluded to, through the legislation that was advanced in the Energy and Commerce Committee last week through the Build Back Better Act, which would provide the resources for every state to do this on a mandatory and permanent basis. And so there's a real focus right now in Congress on getting that across the finish line. And of course, the Build Back Better Act also acknowledges, as Kalisha and Aza mentioned, the need for this really comprehensive approach. And that's what the Omnibus represents. And looking forward to discussing those investments during the conversation as well.
Great, thank you, Jack. Aza in her remarks mentioned, the important role of stakeholders in the process to develop this legislation, the Black Maternal Health Omnibus, and even the Build Back Better Act when it comes to maternal health investments. Black women and birthing people have been so critical in instigating progress on these maternal health priorities. And it has been an intentional focus of both the White House and the Black Maternal Health Caucus to engage them. So we'd love to hear from both Jack and Kalisha about what that process has looked like in terms of stakeholder engagement. And Jack, why don't we start with you?
Absolutely. Well, this has been Congresswoman Underwood's first priority when she co-founded the Black Maternal Health Caucus just 3 months into her first term in Congress back in April of 2019. And that was really to listen to, trust, and invest in the solutions coming from Black communities, Indigenous communities, those who have been doing the work like Aza has for nearly 2 decades on the ground and understand the needs of families. And, Aza had that really powerful quote about what they hear from the people they care for. The type of care and support they receive from Mama Toto Village is different than what they're accustomed to. For as awful as the statistics are, and Administrator Brooks LaSure shared a lot of them, this is not a crisis where we have no idea what to do about it. There are a lot of places in the country where Black women and birthing people go through pregnancy and childbirth in the postpartum period and feel respected and heard and supported in a robust way. And so one of the goals of the Black Maternal Health Caucus was to identify the groups and communities across the country that were doing that work, listen, identify what those solutions look like, and scale them up through the Omnibus. And the Congresswoman has really emphasized that in the now 2.5 years that the caucus has been active. And the main legislative implication of that was the development of the Omnibus and the really robust investments directly in community-based organizations, directly in growing and diversifying the perinatal workforce, addressing social determinants of health, tackling systemic racism head on, as Kalisha alluded to. But none of the work that the Black Maternal Health Caucus would be doing is possible without the leadership of people like Aza and Dr. Taylor and Jenny Joseph, who leads Common Sense Childbirth down in Florida, and Chanel Portia Albert leading Ancient Song Doula Services in New York. It's the people who have been doing the work, who know how to support families, that have really driven the agenda and the legislative process of the Black Maternal Health Caucus.
Thank you so much, Jack. Kalisha, do you want to share anything about the White House's efforts to engage Black women and birthing people?
Yeah, very much so aligned with a lot of the pieces that Jack mapped out. We just couldn't do this work without really listening to folks who are on the ground, who are in community, listening to Black women and birthing people. And I think especially recognizing the goal I made earlier around like, what does it look like for the United States to be the most dignifying place to give birth, right? That does address issues of maternal mortality and morbidity. But I also want to be clear that there are a lot of Black women in this country and birthing people in this country who leave a hospital who after birth, they are healthy mama, healthy baby, as they would say, and they have still had deeply traumatizing experiences, right? So the goal is not just lessening those gaps in mortality and morbidity, it's really understanding qualitatively the birthing experience in this country. And that only happens through listening firsthand, right? Through Black mothers and birthing people. So our approach to stakeholder engagement has also just been one that's multifaceted, one that continues to ask questions. And it's not just, staff at the Domestic Policy Council or Office of the Vice President or Gender Policy Council who's doing this listening. It's something that comes from the top levels. When Black Maternal Health Week came around at the beginning of this year, the Vice President wanted to mark that with bringing to the White House Black women to talk about their experiences in pregnancy and childbirth, right? And it was a small group. We were in the midst of COVID. We had 4 participants for that roundtable, but it leads to a lot of questions, right? Why did that happen that way? What was the access gap? What were the services needed? Why are doulas so important? Right? A lot of the questions are questions that Ambassador Rice really hung on to, and are questions that help to drive how we're thinking about addressing and prioritizing policy, right, within federal government. And also recognizing that there are differences in different communities, right? We spoke a little bit about the systemic racism piece. We've really anchored this conversation and conference in Black women and birthing people. Indigenous women across this country also face, huge disparities in maternal health, and those disparities come from different places as well, right? So we can't just we can't have a stakeholder engagement where we're not also listening to Native American and tribal and Indigenous women and what their experiences in access and in care look like, and what some of their policy priorities look like as well. So really trying to understand the intersection of all of these different pieces, thinking about race, thinking about other identity pieces, thinking about geography, thinking about what communities women and birthing people are in. And you really only get to that through doing some deep listening. So it's something that we're committed to doing throughout this policy process.
Great, thank you both. So racism keeps coming up as a theme, not only I think in this conversation, and we know based on qualitative research that has largely been conducted and led by Black women researchers, we know that how Black women experience racism in the healthcare system is real. The stories are there to show us that. I wanted to ask Aza a question about, how does racism manifest or show up in healthcare? And based on the work and support that Mama Toto offers, particularly for women of color and their families, how is your approach different? And how is your approach offered in a way that is anti-racist and offers respectful maternity care?
So one of the things that is different, and I stress this all the time, is who is offering the care, right? So many of us are comfortable receiving care from people who look like us, who have similar cultural experiences in which we do. And so that is an anchor for our work. The other part is that our care is relationship based. And so we see the person when they come in to receive care from us. We don't just look at them by what it says on the referral or what story has already been documented about them. We ask them for their story, right? From their mouths. We want to hear that. And then the other thing is that we consider the full scope of that person's lived experience. So we are looking at both the health factors, as well as the health factors, as well as the clinical factors, as well as the social factors that are impacting that person's health profile overall, right? And so we address all of those different dimensions in that individualized care plan. Oftentimes in care, you see that you only focus on the pathology and what is in front of you, and simply try to address those things and leave out all of the systemic and social aspects that are directly and heavily weighing on how this person's health profile is showing up. And then lastly, I think more than anything, which is at the root of any relationship base, is cultivating trust, so that if we make a recommendation for a client, that they're more likely to listen, that they're more likely to receive that, because it was given from a place of love. It was given from a place of deep respect. It was given from a place of maintaining personal autonomy and offering them the space to say, you know what, this doesn't work for me, and working to create something that will in fact work for them. And so I think when we think about, we talk a lot about frameworks and models of respectful care. And I always say, like, that's great, right? To me, respect is the minimum. It is the most basic thing that we should offer another human being. And the fact that we are using respect as a baseline for something that is so easy and so simple, right? Speaks heavily to where we are in this country and how far we still have to go. That we are only striving for the minimum, but we're not striving to go all the way, which is to justice. And so for us, like, we continually embody, right, what we say that we do. It's not just that Mama Toto shows up to care in a way that is nurturing and affirming, but we apply and we embody those principles in our own lives, because that's our shared commitment. And that I think that I challenge both our staff, myself, that we have to strive to promote a standard of justice-centered care, one that is anchored and rooted in both reproductive and birth justice. And excuse my busy little human in the backdrop.
Thank you, Aza, and our additional human co-panelist over there with you today. What Aza talked about really, for me, sort of unpacked some of the complexities that are really lie in the experience of Black women, both in our daily lives as parents, really across the spectrum for us. And, there may be some that are participating today, or even those out there that are trying to wrestle with, whether or not they support the Black maternal health Omnibus or this broader comprehensive set of issues that we're focused on in order to advance maternal health equity, because they don't have a grasp of those complexities, they may say, why are there so many bills that are a part of the Black maternal health omnibus? Or couldn't we just solve the maternal health crisis if everyone had health insurance coverage? Why is it so critical that our response to Black maternal health be comprehensive? Jack, I want to start with you on this one.
Yeah, absolutely. Well, I think this really gets to what Aza was just talking about and what Mama Toto Village provides, which is that it's not just about addressing the clinical needs of the person that they're caring for. It's about addressing those social factors as well. And, Congresswoman Underwood is a registered nurse, one of just a handful serving in Congress. She has a really strong public health background, and she brings that to the work that she does. And so, you think about an example of someone who doesn't have access to stable, high quality housing during pregnancy or nutritious foods. Those will obviously have implications for what's going to happen during the childbirth and postpartum period. And so with the Omnibus, what the Congressman set out to do was really, step one, identify all of those comprehensive drivers, both clinically and non-clinically, that are leading to adverse birth outcomes. And then identify evidence-based solutions that center the people and families impacted. But I really do want to underscore the importance of what Aza and Kalisha both said, with Aza talking about respect being the bar, and Kalisha mentioning, something that Congresswoman Underwood has said and talked about, particularly in the reintroduction of the Omnibus this year, is that while we are obviously trying to eliminate preventable maternal mortality in the United States, survival alone is not the end goal here. It really is about striving for more and doing so much better, like families deserve. And so, looking at what's in the Omnibus, part of it is about ensuring that there is respectful, culturally appropriate, dignifying maternity care. A lot of that has to do with, as Aza said, about the importance of having providers who look like you, growing and diversifying the perinatal workforce. And we're talking about both clinical providers as well as doulas and peer supporters and birth companions that are really critical throughout the perinatal period. And then also addressing some of those factors, those social determinants of health, like housing and nutrition and transportation, and really trying to address it systemically. Of course, coverage is really important too. If you lose access to coverage in the postpartum period, as we mentioned with Dr. Taylor's research, you can lose access to maternal mental health care if you have postpartum depression or a substance use disorder that extends beyond 60 days after pregnancy. So coverage is a critical piece of it, but coverage alone doesn't solve the crisis. I think we actually saw someone in the chat mention the example of Serena Williams. Serena Williams had access to the highest quality care and certainly health coverage, but nearly lost her life. And for Congresswoman Underwood, it's really personal as well. One of her graduate school classmates, Dr. Shalon Irving, who is a dual PhD CDC epidemiologist who literally dedicated her life to studying health disparities, died from pregnancy-related complications 3 weeks after giving birth to her first daughter, Soleil. That wasn't because she didn't have health coverage or that she didn't know how to navigate a healthcare system. That gets to those systemic racism causes that have to be rooted out in a comprehensive way that aren't solved just by having insurance alone or by looking at one particular driver of the crisis alone. And so the Omnibus includes 12 bills because we don't think that you can address this crisis and achieve true birth equity and justice for all without a comprehensive policy solution.
Thank you so much, Jack. I don't know if any of our other panelists wanted to respond to that question as well. Jack stated it so beautifully.
No, I second everything Jack said. And I think in addition to focusing on social determinants of health, many of which Jack pointed out, it's also thinking about what whole of health looks like, right? Women and birthing people are people who deserve quality healthcare outside of that experience, right, as well. And there are so many other health pieces that go into the experience of pregnancy and childbirth. So what does it look like on day one with a provider to not just be focused on the 40 weeks ahead of you in a pregnancy and the process of childbirth, but to be given a paper on day one that maps out different mental health services, or that maps out different support networks, or that maps out chiropractic care or other parts of care, right? What does it look like to look holistically at people and to really redefine what healthy looks like in this process, and to really just shift attention to whole of health, I think is incredibly important.
Great, thank you. So we've talked about the Build Back Better Act and, the fact that some of our maternal health priorities, investments in those priorities have been included. Jack, can you talk a little bit about, what the highlights are from that bill? We've talked a lot about the mandatory and permanent postpartum coverage extension piece, but the legislation also includes investments in the Omnibus. And so would love for you to go over that. And then also just give us a sense of, what's next in terms of the process. We're not yet over the finish line. We still have work to do in order to see these investments passed.
Absolutely. So Congresswoman Underwood and the Black Maternal Health Caucus were so excited last week to see the Energy and Commerce Committee advance Build Back Better Act legislation that included actually every eligible provision of the Omnibus that we could get into a reconciliation package into this Build Back Better Act. I encourage you all to check out the caucus's Twitter account at BMH Caucus. You can find a whole bunch of summary documents going through everything that was included. But just to highlight a few especially important pieces, to get at some of these things that we've just been discussing, the legislation includes $175 million in funding for local entities to address social determinants of maternal health. And within that, there's a set aside $75 million minimum just for community-based organizations. This we know is something that Congresswoman Underwood has prioritized. It's also something that she worked really closely with then Senator, now Vice President Harris on. Vice President Harris was actually the lead Senate sponsor of the Omnibus in the previous Congress. It's now led by Senator Booker, but both Vice President Harris and Congresswoman Underwood, and now Senator Booker, have really emphasized the need to ensure that there are funding streams directly for community-based organizations. We know that if there's funding that community-based organizations are eligible for, but they're eligible among a whole bunch of other larger entities, the funding usually doesn't go to community-based organizations. But you've heard about what Oz is doing, and so many groups like her and other communities across the country. We need to get funding into those models and to those organizations, and those investments are included in the Build Back Better Act legislation. There's also $275 million to grow and diversify the perinatal health workforce, again, including a designated funding stream specifically for doulas, but also thinking about certified nurse midwives and nurses and physicians and maternal mental and behavioral health professionals. Again, this really gets to the idea of having choice in care that you receive during and after pregnancy. There's other funding in there for maternal mental health equity grant programs, funding to address the impacts of climate change related maternal and infant health risks through health professional schools. Some of you might be familiar with research that came out last year showing that climate change related risks like air pollution and extreme heat are associated with adverse birth outcomes and really significant racial disparities that are disproportionately impacting Black families. So there's funding in there to address those needs. Again, I encourage you to take a look at the caucus website and Twitter account for a full list. But the Congresswoman and the caucus are really excited to see this progress. As Dr. Taylor noted, we still have a long way to go. It's only advanced out of committee. The bill needs to get put together into this broader Build Back Better Act legislation, has to pass the House and the Senate. We're confident that if we can get it to President Biden's desk, that he'll sign it into law and get this funding out to communities where it's needed. But one thing that the Congresswoman has really emphasized is that people making their voices heard about the urgency of making investments to address this crisis will be critical in moving this legislation forward. And again, we're so grateful for all the organizations here who have really lifted up their voices and elevated the urgency of these investments. As Dr. Taylor mentioned, it's these Omnibus investments plus the mandatory provision to make federal funds permanently available for postpartum coverage. And comprehensively, these really can get at all those drivers of the crisis. And hopefully we'll have some more exciting updates for you in the weeks ahead as this legislation progresses.
Great. Thank you so much, Jack. I want to shift to Aza. Aza, one of the things that we've been talking about as part of, the bill that came out of the Energy and Commerce Committee is that it did include this mandatory permanent provision that would extend postpartum Medicaid coverage to 1 year. As a community, we acknowledge that the advancements that were made in terms of the state option as part of the American Rescue Plan Act was an important first step. But why is making this provision mandatory and permanent so important for Black women and their families?
So Loretta Ross says that women of color in the US have to negotiate their reproductive lives in a way that combines various interforming and interlocking forms of oppression. Our abilities to control what happens to our bodies is constantly challenged by poverty, by racism, by sexism, homophobia, and all of these other facets of injustice. And despite policies and agendas that are designed to control or limit reproduction, as we see it's happening right now throughout many states with abortion access, despite having limited access to facilitate a reproductive plan on people's own terms, despite losing access to care during critical life periods where there are documented higher rates of maternal mortality and morbidity, where relapse and suicidality threaten those in need of vital connection and support. If we are going to reimagine a future that operationalizes reproductive justice and birth justice and advocates truly for a model of care that's not, again, simply rooted in respect, but justice, like to me, this legislation is the way to do that. And there's no other equitable gap filler than meeting the demands of what we are requesting, which is permanent and mandatory postpartum Medicaid coverage. As Jack said, that coverage alone is not going to meet the entire need, but it is a step in the right direction. It is a step towards how we can innovate and think about high quality, anti-racist and culturally responsive care. And it really does, again, create opportunities for providers to engage with birthing people beyond that one interaction that happens at the 6-week visit, but keep an eye on things that are happening in people's life throughout the span of that first year, where so many things are coming up. Even if you don't have morbidities, as a parent, all of us can remember how we felt after having that first or second child, that you need help, you need support, you need somebody to talk to. And so I think that this legislation is so critical to reducing some of the disparities that are existing for Black birthing people in this country today.
Great, thank you so much, Aza. And just wanted to flag for folks that the Century Foundation has conducted research looking at the impact of coverage loss for new moms after 60 days. That report, Promoting Better Maternal Health Outcomes, is on our website if you want to take a closer look about how this loss in coverage impacts the health outcomes for new mothers in that period. So why don't we take a shift right now to audience questions? We do have quite a few here, and hope that we will try to get to as many as possible. The first is, this is about the Omnibus, so we'll direct this to Jack. Recognizing that the Omnibus is 12 bills, what is the likelihood that this will move through Congress all together? And are there specific bills within the package that are more likely to move first?
Yeah, that's a great question. So for a little bit of mechanical background, Congresswoman Underwood and Senator Booker introduced a bill called the Black Maternal Health Omnibus Act, and it's a massive bill package that includes 12 individual sections called titles. Those 12 titles were also introduced as standalone bills. So hopefully we could see progress on some of the individual bills while keeping our eye on the ultimate goal, which is advancing the comprehensive package. And so for the great question that was asked, we've actually, even prior to the Build Back Better Act legislation, seen progress on some of the individual bills in the Omnibus. Actually, back in May, the House of Representatives passed the Protecting Moms Who Served Act with unanimous bipartisan support. Anyone who's following Congress knows that doing things with unanimous bipartisan support is pretty difficult. But this bill within the Omnibus focuses on maternal health for veterans. And so we're hoping to enact that bill, again, with bipartisan support. And that's one piece, the Omnibus. There's another bill called the Maternal Vaccination Act, which focuses on increasing immunization rates during pregnancy, which is critical for both mothers and birthing people and their babies. That bill advanced out of the Energy and Commerce Committee earlier this summer with unanimous bipartisan support. So we're really seeing and have seen over the course of the past year some important progress on individual components. But as this conversation has really underscored, we cannot deal with this issue without a comprehensive approach. And that's where the Build Back Better Act is so exciting because, as mentioned, it does include every eligible provision of the Omnibus. So we're looking at the social determinants and the perinatal workforce and maternal mental health equity and protecting moms and babies against climate change and digital tools, technologies that can promote maternal health equity. recognizing that we need to make all of these investments. And so we really look at the Build Back Better Act as a unique, potentially, once in a generation type opportunity to make these investments. And that's why Congresswoman Underwood and the Black Maternal Health Caucus have been so committed to trying to get these across the finish line.
Great, thank you so much, Jack. And the next question is directed to Aza. This person is stating that, our systems do not pay providers for the type of care, Aza, that you outlined, the type of work that Mama Toto is actually doing. And our system has pressures for providers to see a large number of clients and incentivizes certain procedures. And the question is anyone addressing these problems in terms of our payment systems?
So there are initiatives that I do know are underway around alternative payment models, and some of those things are being tested out or piloted throughout the country. I know in DC in particular, our Medicaid system put together a 5-year strategy where they are actually moving towards a more alternative payment structure in rate capitation, which means that instead of doing fee for service, it's either going to be an upside risk or a downside risk to the provider. And if you give high quality care, you will get incentivized with that based on your outcomes, right? So it moves us from this model where you are being incentivized for procedures to being incentivized for giving high quality of care, and really shifts care into a space where you can individualize it. You can spend more time with the people you need to spend more time with and spend less time for the people who may actually not need a whole lot of support within those visits. But I do think that that is an important construct as we think about what are the policy levers that can be activated towards encouraging more movement towards alternative payment models, because fee for service really is not going to get us there, especially when we think about Medicaid, where Medicaid reimbursements are oftentimes lower anyway. And so people are not incentivized to even want to take Medicaid patients. And when they do take them, you're not incentivized to really give the best care that you could possibly give. So that is how I would kind of approach that question. But I do know that there are some things that are happening. And if you look up the Land Summit, they actually created a maternity white paper specifically laying out a whole framework for how to implement an alternative payment model structure.
Great, thank you so much, Aza. The next question we have is about data collection, and I offer this to anyone who would like to answer. Do you have ideas about what data would be helpful for healthcare providers to collect to help eliminate the high mortality rates among Black women and birthing people in the United States? I don't know if anyone wants to respond to this one. I don't know, Jack, if you want to talk about the legislation as part of the Omnibus that gets at some of the issues around data collection.
Absolutely. So the Omnibus, as mentioned, there's 12 bills in there. One of them is the Data to Save Moms Act, recognizing that for as much as we do know that we have a crisis, we know that general maternal mortality rate, which is, looking at pregnancy-related deaths per 100,000 live births. We have data like that. We have information on the disparities, but there's certain levels of granularity of data that we're still lacking and that we still need. And there's also significant fragmentation between states on their data collection processes and reporting processes that make it really hard to make comparisons across time and space. And so the Data to Save Moms Act really just calls for a comprehensive review of data collection processes and quality measures, which really inextricably linked topics, and making recommendations to improve those processes. So part of that would address the data that we're collecting in maternity care settings. So encourage you to take a look at that provision of the Omnibus. The standalone Data to Save Moms Act was introduced by Congresswoman Sharice Davids, and it also includes a really specific emphasis on maternal health in Indigenous communities.
I would also like to tag in and say that within your agencies, depending on what system you're using for your EHR, You want to think about utilizing those Z codes, which already exist for social determinants. A lot of times in clinical settings, people are not using those Z codes. And so it really does give you an opportunity to have a bird's eye view on what is actually happening amongst the population and what social issues are existing, and then allows you to allocate resources appropriately. So that's another area where I would encourage that. And then lastly, thinking about ownership of data. Oftentimes, again, we keep data within our own silos and within our systems and don't share that data back into the community. And so if we're moving into this space of moving in the direction of justice, it's really important that we move all the way and not kind of incrementally, but that data sharing piece is really important for those organizations within your community to be a part of the solution.
Great, thank you. The next question is there any funding or policy towards the education of postpartum doctors and nurses that they receive in order to improve systemic problems?
Well, I'll note one provision of the Omnibus that's included in the Build Back Better Act legislation advanced out of Energy and Commerce, and that's funding for bias and anti-discrimination trainings. Again, this is a great example of something that on its own isn't going to eliminate this crisis, but we know that organizations like the National Birth Equity Collaborative, led by Dr. Joya Creer-Perry, have really done a lot on these trainings that are ensuring that our maternity care professionals are listening to patients and can identify warning signs in the postpartum period. One other initiative that might be worth taking a look at is the CDC's new Hear Her campaign. Actually, one of the faces of that campaign is the great Allison Felix, one of our winningest U.S. Olympic athletes of all time, who has her own story that she brings to this. So would encourage you to take a look at some of those.
Great, thank you, Jack. The next question is for Kalisha. The question is it likely that the National Gender Strategy will touch on disparities in maternal health outcomes? If so, can advocates and policy experts be helpful to agencies during the implementation phase?
Yes, and yes. I think we, and just for some background, as many of you might know, we are literally in the midst of finalizing the first ever U.S. government national gender strategy per the executive order that founded the Gender Policy Council. It is due to the president this Friday, and there will be a public release of it down the way, which will make sure that stakeholders are very clear about. But yes, I mean, this is an issue that is a priority for the Gender Policy Council, as it is folks across the building. And so it is something we'll speak to in that strategy. And it is something that we will be a focus for on implementing that strategy as well. And I think very aligned to sort of Jack mapping out Omnibus and the comprehensive approach and looking at all of the different social determinants and all of the different pieces. Our interagency policy committee and internal policy process within the administration is very the White House talking to HHS, which is of justice, and it is over 9 federal agencies and many executive office of the president components who are at the table to really think through what our maternal health agenda looks like. And so as we work towards implementing the goals that we set out in that strategy, we'll do so in that whole of government way that considers all of the different pieces and levers that impact maternal health in this country.
Great, thank you so much, Kalisha. So we have time for one more before we close up today's panel. And this question is actually from me. Where do we go from here? What are the next priorities in achieving equity in maternal health, as well as how can we keep up the pressure to ensure that our investments are actually passed as part of reconciliation? So anyone who wants to start, this is directly to all of you.
I'll just say let's start by getting the Build Back Better Act and these critical investments across the finish line. Thank you so much.
Aza,
what was the question? I'm sorry.
Where do we go from here in terms of our next priorities on achieving maternal health equity?
Yes. So I think that one, like every piece of policy, has to have, as we're thinking about maternal health in our quest for birth justice, like we really also need to have some economic justice as a part of that to really equip people with lifelong resources to thrive, including providers, as in the conversation earlier about moving towards alternative pay structures and models. I think also just making sure that the investments that are outlined in this act are all passed as a part of reconciliation, and really thinking about how do we establish through policy a standard of justice-centered care.
Thank you. And we'll end with Kalisha.
I would just say continuing to follow the leadership of Black women and birthing people and people with lived experience. And many of the really tough questions, there are a lot of tough questions in solving this crisis, become more clear the more we make way for that in policy. So I think that is truly the way forward.
Great. Thank you so much to this rock star panel. I am a huge fan of all of these folks. Thank you again to Administrator LaShore for being with us today, and Mark for his introductory remarks. Thank you to all of the participants for attending the event. A recording will be made available immediately following on tcf.org. There, you can also read our research and analysis on Black maternal health, including a brand new tool that we have that is tracking progress of the Black maternal health Omnibus. Check it out. Let us know what you think about it. And on our website, you can also learn about more of TCF's events. Last but not least, I want to close by thanking the Irving Harris Foundation for their generous support and for partnering